Welcome back. This is Fantastic Pains and How We Hide Them. I'm not Chris.
And I'm not Karina.
But we are here together.
As usual.
For more shenanigans and fun times.
Mm-hmm.
And we are rowdy today.
Yeah, it's a day. It's got to be a result of the week or something.
It was a really long week.
Yeah. I don't know if you guys felt it. We felt it.
Yeah.
Very long.
Oh. Oof. That was a big oof kind of.
Boof.
Week.
Yeah.
Boof. Yeah. If this is your first time joining us, I hope you had a better week than we did, first of all.
Mm-hmm.
Also, welcome. We are a sibling duo. We both have Ehlers-Danlos type 3 or hypermobility type and a slew of comorbidities and mental illness on the side for fun, you know.
We have a little of everything.
Yeah. And why are we here? What do we do?
Oh, we're here to talk about death and make you feel sad and stuff. Oh, no. Wrong podcast.
Bye.
That's the mortician podcast that we have. We're not morticians.
We're not morticians.
We just review them.
Yeah. No. We're reviewing morticians.
Anyways, so if you're here, you might have a chronic condition. You might just have a hard time in life. And we're here to make you feel less lonely.
Yes. Our
Shared
mission
experience.
is make everyone feel a little less alone by exposing the suffering around us and within our own lives and creating a space to relate to one another.
Yes.
Yeah. Along with that, we do have a thriving Discord community, which we love.
Oh my God.
It's our baby and it's the best. You can also find us if you don't want to watch us on most podcast formats except for Apple.
Yeah, the major ones minus Apple. And
Yeah.
I'm working on getting us on all the little ones.
Yes.
There's a lot of work that goes into it.
And that includes sites like Spotify
Heart
and
FM.
What?
Heart FM.
Really?
Mhm.
Oh, that's cool.
Audible.
That's the one I was going for.
Mhm.
Yeah, lots of different places.
Yep.
And then if you do want to watch the shenanigans, because we are a sibling duo, it gets a little crazy. You can watch us on YouTube.
We talk with our faces. So, but
Very
at the same time,
expressive.
I've been told that I have such a voice that they can hear my facial reaction.
Yes.
Like they can tell if I'm smiling or not.
Yeah.
It's weird. I never smile, so how can they tell? Weird. Anyways, we also have a TikTok.
Yes.
Where we put all of the in-between cuts, funny things,
Rants.
lots of rants.
Oh, they're great. I
Mhm.
love them. So super funny. Love it. Go check it out.
Yeah.
What are we talking about today?
We're talking about everyone's favorite subject. Nurses that definitely believe that you're in the ER for a good reason.
Yep.
That's sarcasm, by the way, for those of you who
Yeah.
can't tell.
So
Oh,
stick around. We're going to get angry. It'll be good. But
yeah.
before that, it is time for the weekly recap.
Check in.
Waha. Yes. I don't even know
I always have to go
where to
first.
start. Yeah.
I'll go
first.
Let's see. I had a week. I always have a week on these. Sometimes even two. Uh,
It feels like two.
oh my gosh.
Whew.
Let's see. We did a lot of cleaning around the house.
Oh, nice.
You can't tell because we have kids and they ruin things instantly. But it was clean for a while. And Jen's been suffering with a major migraine.
Oh,
like,
no.
remember how she had that migraine last weekend?
Yeah.
It didn't go away until like Wednesday or Thursday.
No.
And she had to work on Wednesday and Thursday. So she
Ooh.
spent Monday and Tuesday in bed, basically,
Poor Jen.
with like her head covered up. And so I did a lot of, like, that's when the cleaning got done. Because I was
Yeah.
like, I want to make it nice for her.
Yeah. Well, good.
And
Oh,
the kids
that's
helped.
rough.
Yeah.
Yeah.
The kids have been buttheads lately, but you know,
They're going through it.
with each other. It's like they rile each other up, get angry, and then they come at us with that anger.
Uh-huh.
Like Sophie will get riled up and then come to us and be like, I'm going to argue with you. Like,
And you're like,
there's
why?
there's no arguing.
I don't want to.
You know, like she has to get rid of that energy because Rory
Yeah.
doesn't listen. He'll walk into her room, say really offensive things, and then leave. And she's stuck here with this, like,
Not being able to respond.
right.
Yeah.
So she comes to me, and instead of being like
Frustrated
narking and being like,
energy.
Rory said mean things, she's like, can I have a soda?
Also, I
With
hate
the attitude,
you.
with the attitude off the bat, right? Like, and I'm like, no, we're almost out. Mom gets all the soda. Like, well, she does because she buys them. They're her sodas. That's why I can't give them away. That's not fair. It's absolutely fair. You could buy your own soda. I don't have money.
Don't you
Yeah, but
love
you have a
it
chore chart, so you could make the money.
when they're like, I'm gonna bait you into an argument now. Here we go. Are you
just-
ready?
It's
Are
like
you ready?
it reminds me of working with horses. Like when you're working with foals that are really obstinate
Uh-huh.
and they're just like they don't want to listen to you. They just want to just so it's a personality conflict because
Yeah.
they have really strong personality.
Yeah.
So like you'll get some pushback on some.
Mhm.
And if it to me it's like the same thing. It's like I have to you walk the horse.
Yeah.
You got to get used to each other and kind of break the boundaries down. It's the same thing I do with them. I'm just like leading them through the argument they want to have.
Yep.
And at the end I'm like nothing's changed.
Yeah.
But she feels better. So I had a lot of that.
They'll get there. It'll
And
be
editing
fine.
was really good.
Good.
Thank God.
Yeah.
After last week. How was that, by the way? Like
I hope it was good.
if you watched
I
it,
liked it.
let me know if you liked the graphic because I might need to use that technique more often. Even though it took me a good 18 hours just
Ooh, that was a lot of work.
yeah, compared to what I normally put into it.
Yeah.
Like it tripled my work time in just one day. It's crazy.
Ugh, emergencies, man.
Yeah. And how have I been health wise? Oh, I fell down the stairs
Oh,
twice.
yeah.
Twice.
Stop that.
And then my knees got locked under me when I fell. So Jen had to come down,
Oh.
straighten them, and they wouldn't pop. You know, like how you get to a
You
point
can
and
get
they
it and
slide
it's like
in.
coming toward,
Right.
and it won't just settle in.
Exactly.
Yeah.
So like they were straight and they were still. My kneecap was off, I think.
No.
And I was really upset about that because it hurt real bad. I was like,
yeah.
what do I do? Do I
Yeah.
punch it? Do I, you know what I mean? Like, is this gonna hurt more? Am I gonna make it worse?
Right.
So she
Oh.
did the smart thing. She like bent it a little bit and then tugged on it real quick. Like, before I had a chance to be like, no, don't do that.
E.
We got there,
Mm.
and then I had to go lay down and rest and
Yeah.
fatigue.
Yes.
Oh,
Man.
there were 2 days where I couldn't get up and moving, and I tried.
Yeah.
And I didn't have my Concerta, so it was like, just go to bed, Chris, sleep. But I
Bedtime
don't want to.
forever.
I'm not comfortable in bed. I have things to do.
Yeah.
I don't like this. No,
Yeah.
you're sleeping now.
It's
And
like
it's the kind where like you
Wednesday,
don't know you're
Thursday.
falling asleep.
Mhm.
Like you're like, I'm getting up, and then you wake up, and you're like, that was
Again,
2 hours
you're like,
ago.
what the heck is going on? You just keep losing time and
Yeah.
you don't remember.
I hate fatigue.
Fatigue is the worst. Fatigue is like what breaks me down
I was gonna say, like,
to my bones.
of all the symptoms we get, I'll take pain any day.
Yeah.
Fatigue, I
Pain?
can't handle.
Fine.
There's no coping mechanism for how to deal with not being awake.
Right. Or like I just hate hearing pacing when they're like, dude, you need to do pacing better. And you're like, you don't understand when the body says you are not doing things today.
Yeah.
There's nothing you can do about that.
No.
And then they're like, I don't know.
It's like a misunderstanding because you have people who think you overdid it
Yes.
and then you had fatigue.
No. Fatigue is its own monster.
And then there's people who think that you're just being lazy.
Yeah.
Because they can't. There's no way to understand the feeling of not having energy to move a
Yeah.
leg.
it's like if you were on Benadryl, but all the time.
Yeah, you're
Just
in that,
randomly.
that
like you
daze,
woke
like-
up and now you're on Benadryl.
And
And
then right, you took your
if
Benadryl.
you don't go to sleep, you're going to have a really bad time.
You took your Benadryl and you woke up 2 hours later, and you're feeling it.
Yep.
That's like the peak.
Yeah. Oh, it's not fun.
No.
Not fun.
No.
God.
So we had to suffer through that. Had a little scare there in the middle of the week that I can't get into.
God.
And then it was a lot of playing Splatoon with my wife. Actually, it was really enjoyable
Oh, fun.
because that game's pretty chill, and
Yeah.
we got to do that together, and I had a lot of fun.
Good.
And that was my week.
Nice.
Pretty chaotic.
Yes.
Yours was worse.
My week, I can't even remember days. So I'm just going to go through the events
Okay.
as they kind of happened.
Yeah.
So I feel like there was something at the beginning of the week, but I don't know what it was. I was on, so I hurt myself over the weekend. And it's not like I like hurt myself. It was that like I had been hurting up until that point.
Yeah.
And then it got worse.
Right.
Because I went to step over a cat and the cat went underneath my foot. And then I had to like pivot and I did
Yeah,
something horrible to my hip and to my back. And I was in horrendous amounts of pain.
Yeah.
So I went in late on Monday, I think. It was either Monday or Tuesday that I went in late.
I remember because
Tuesday.
you
Okay.
messaged me on Tuesday, and you're like, "This week is already horrible."
Yeah. I was not having a good time. I had to
Yeah.
go in late on Tuesday because I was in so much pain and I had to medicate like first thing in the morning so that I could like hopefully be functional by noon.
Yeah.
And that was all I could do. It's just been not fun. So I spent 2 days with my cane and kids being like, what's wrong? What happened to you? Are you okay? Did you hurt yourself? What's going on? Is this part of the blah, 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 blah?
Yeah.
So trying to explain to everybody. And then Wednesday was just a day. It was a day. It was just, it was great.
Which day did that shenaniganry happen? Like, I don't want to get into specifics, but we talked about it last night.
Oh, yesterday, I think.
Oh, okay, yeah.
Unless it was the boss shenanigans.
No, it was the one you were thinking of.
Yeah.
Yesterday.
Okay. Yeah. So Wednesdays are always just weird because it's PD and we like different things, different days.
Mm-hmm.
And so that was heavy and everyone was very angsty. And then let's see, Thursday I had my procedure.
Oh yeah.
So they did an upper endoscopy, and then we did they were like, if it's safe, we will expand your esophagus today. And I was like, cool, let's do that. And so they did. Took a couple biopsies, but it was funny because remember how I said that the PA was going to put in my file that I needed better anesthesia?
Like an actual anesthesia. Yeah.
So I learned that the first time I didn't have an anesthesiologist because it was just like standard sedation, and it wasn't enough. And this time around, they gave me an anesthesiologist, and he made me go night-night.
Good.
It was like...
You needed it. Like,
yeah.
Ugh.
So all of that happened, and then I went home, and I slept and sweat out all the anesthesia. And yeah, that was fine. Like, it was fine. And then Friday was crazy.
Was Friday the day where most of the teachers were gone? Is that what you're saying? There was a day
Monday.
where like I think
Monday.
right,
Yeah. Monday there was a ton of people gone. And so that was fun. And then it snowed, and that was horrible because Thursday night I was feeling it and I was like, what is going on?
Yep.
And then of course it was snowing. And so the weather has been horrible. I reached out to my pain team. I have an appointment coming up, but I did have a moment of like, I had to stop and feel sorry for myself for a little while because I was just so frustrated because my back was hurting so bad, and laying down hurt, and standing hurt, and sitting hurt. And there was no relief outside of like being in the bathtub.
Yeah.
And even that, I was like, POTS can't stay in the bathtub forever or you end up getting sick. It was Monday that I ran around attached to the TENS machine all day.
That's
because
what it was,
I couldn't function. Everything hurt so bad. I was so miserable. And then yesterday, my jaw, like I yawned at some point and my jaw went, it was like a weird, like snappy pop. So it was just a different sound.
Yeah, it wasn't like when your jaw dislocates.
Yeah.
But I know what you're talking about. If like it's like
it was
a
like
tendon or something snapped across
something and was out of place.
Mm-hmm.
And then the muscle had a fit. And so for like 2 hours, it was progressively getting worse, where my jaw was being pulled like to the right and then back. And it hurt so bad. Like it was 8. I told them 8 when I got there. And he was like, okay, open your mouth. And I did at some point. And he was like, oh, okay, so you're not in that much pain. And I was like, I'm going to kill you. And so we did x-rays and they offered me ibuprofen. And I was like, no. And she just kind of stopped and looked at me and was like, what? And I was like, no, I take a ton of Tylenol. Ibuprofen is bad news. Can't do it with my stomach. And I have better drugs at home. So if you don't think it's like a real problem, like all I needed to know was like, is this an actual issue?
They treated you like you were at an ER though, which is what's weird. Like you gave them a pain number and they're like, oh, it's not that bad.
Right. Yeah.
It's urgent care. You go there for the like checkups. It's like a pit stop.
Yeah.
You go to there when you were like, something might functionally be broken.
Right.
I need to know.
Well, because I was like, it's been 2 hours and like usually something will settle back into place or I can pop it back into place. Or it'll change. Yeah. But it was just steadily getting worse. And it was like a just stabbing sharp pain in my jaw. And it was this muscle that goes all the way up. And then I was feeling it in my eyeball and in my ear.
Yeah.
And that was super fun. But yeah. So they offered me ibuprofen and ice packs. And then we did x-rays. They said nothing is broken or dislocated. Bye-bye. But
Well,
she did say that like if it keeps happening, you can go to your dentist, and the
get
dentist will
Botox.
do Botox.
Interesting.
But she was like, yeah, no, it's a muscle spasm.
So that's why we're talking about this stuff today, because it's just the way you get treated in urgent care or in the ER.
If they decide that you don't have a problem, great.
We've talked about it before, but we wanted to talk more about what's the word I'm thinking of? We've never really done like story times about it per se.
Oh,
then like how to cope with that situation.
Right. Because it is so disheartening to have somebody be like I was messaging you and I was like, I regret coming here.
Yeah.
I regret this. Like if it's not dislocated, that's all I really needed was like somebody be like, no, structurally it's fine.
Right.
And then cool. That's all I need.
But
I need like informationally.
Yeah.
I need so that I know whether or not I need to do something, because having chronic pain, we are prone to ignoring pains that could actually be problems.
Exactly.
And so we go in to get them checked out, and then we get treated horribly by people who are just like, why are you even here?
I get so worked up thinking about it because
it's horrible.
It's ridiculous.
Yeah.
Like, and it's always med related too. It's never.
Yeah.
At least I haven't experienced like hypochondria as like a thing, or like Google, like you Googled this and now we're gonna look down on you kind of a thing. I know those biases exist where people are like, if you come in and you think you know what it is, and the doctor wants to know more than you.
Right. Or they're upset that you know what you know.
Right.
Because they're like, oh, you've been on Google. How dare you?
Most of what I get is like getting treated like I'm a drug seeker.
Yes.
Only because I have a prescription.
Mm-hmm.
That's it. That's it. Literally, they look at the list and they go, are you taking your medications? And you go, yeah, I'm taking them. Is this accurate? That's an accurate list. And then they're like, oh, and then you get treated like shit.
Yep.
Instead of just asking
they're like,
you to,
oh, you're on painkillers.
Could you imagine if it was more candid and it was like,
right,
are you here because of your pain meds? And you're like, no, I'm good. I'm not abusing them. I'm where I need to be for the month. And then they go, okay, so why are you here? They do the why are you here, but they always skirt the like main thing that they want to know. Like,
well, and they're always like, because they have to soften everything, right? So they're like, so what brings you in today?
Yeah.
Tell me what happened. And you're like, nothing happened. That was the other one where I was like, no, there's no injury. Because they were like, you like fell, you hit it. And I was like, no, there was no injury. I have Ehlers-Danlos syndrome.
Yep.
I dislocate. And she was like, oh, so you have like a baseline connective tissue disorder. And I was like, what does that mean?
Baseline connective
but
tissue
also
disorder?
It's because they don't understand what that means.
Right.
And that's the problem.
That's why
I'm like, I just need to know if it's where it's supposed to be.
Was it your neurologist who said they would do research? Or
yeah.
Mm-hmm. Because he was genuinely interested in it and didn't have the answers and was like, I'll find the answers.
Right.
Why can't they do that?
But there are so few who can and will do that. It's just
okay. So this reminds me of one of the times I went in for MCAS before I knew what MCAS was.
Uh-huh.
Keep in mind that at the same time I was having a bad reaction to Butrans patches, which are the first of the patches I tried. They're opiates release, like delayed release things that go in your shoulder.
Yeah.
And they give you the meds. But for me, they release way too much too quickly. Like I absorb it too quickly.
Yeah.
And most pain meds like that are on the opiate scale, I react horribly to.
Mm-hmm.
Like hospitalized. Bad.
Yeah.
So I went in, they looked at the list and they're like, so why are you here? And I was like, well, look, I'm all red and swollen. And they're like, did you eat something? Like, no. Did something change in your environment? Do you have a new shampoo? Like they were thinking allergies, right? I'm like, no. And it was really, I mean, I could see it now and be like, oh yeah, like you can kind of see already. Like I am getting MCAS.
Uh-huh.
Like I have a red patch right here.
Yeah. Oh well, let's see.
I don't know if it'll catch it though.
Yeah.
But
we're getting there.
Yep. But he treated me like absolute dog shit the entire time I was there. Because all I wanted to know was, is this going to be something that I need to take like an EpiPen for?
Right. Like, should I be concerned?
Right.
Because it's so frustrating because that's the question, right? is that we don't have a like, oh, I am concerned.
Mm-hmm.
It's a like, should I be worried about this? Because this is not a normal thing for me.
Right.
If this had happened a different way, I would have been like, yeah, totally fine, whatever.
Well, and side note, like every time we do these things, like when we go in, I'll bet you 90% of the time, at least for me, and I'm pretty sure for you too, you went in because you called the nurse hotline to make sure it was something worth going in.
Yep.
And they acted more dire
chiropractor first, and
right.
they were like, "Oh my gosh, we can't even touch you. Like, if it's dislocated, we could get sued." And so that was why I went in, because I was like, "Chiropractor won't touch it. It hurts unbearably. I don't know what to do."
Right. Make sure everything's good.
Like, should I be like treating this like it was a normal occurrence, which would be taking a muscle relaxer and my pain medication. And then that's it. That's all I need. So no, I'm not there for pain medication. Right. I don't care. I have it. But
isn't it a fun experience to go, here's a new problem for me. I don't know how valid it is. So you call the nurse hotline and they go, oh shit, yeah, that could be a bad thing.
Yeah.
You need to go in and take it seriously. So you come in because the nurses told you that it's a big enough deal to have it looked at. Yeah. You show up and then you're like, well, why are you here? Well, I called the nurse hotline. I have this problem. I don't know what's going on. And the good doctors, at least in my experiences, have been like, what do you expect to gain from this? Right. Which is like the way the code
that's
for
perfect question.
What do you want me to do? And you're like, I need to make sure that everything's functioning and that I'm not going to make things worse somehow. Yeah. That's it. I'm not here because the pain's unbearable. Right. I'm here because I'm worried about functionality.
Yep. Or like, am I gonna gloss over something that is an actual problem one day?
Or you get the opposite, where they don't really talk to you, and they've already made the assumption because they've done your intake, and they saw what you're on. So in my case, when I went in for the MCAS thing, they saw that I was on really high dose of Butrans,
because it was way back when,
back when like the I had a tumor in my spine that was causing me severe pain, so I was on a lot of opiates. Like, if I wanted to abuse them, that would have been my fucking golden era.
Also, how could you abuse them at that level?
I can't. It would die. It's not fun. It's like, here, try this morphine pill. And you take it and you're like, I feel like I'm going to die. And they're like, yeah, but did the pain go away? I don't know anymore. I'm shaking. I'm red. I can't think straight. I'm freaking out.
And I'm itchy everywhere.
But, okay, so, like I was saying, I went in and I was MCASing, and they thought it was a reaction to the amount I was on, the amount of meds, and they thought I was looking for more.
But yes, because opioids are gonna opioids are gonna fix the allergy thing,
right?
What?
Well, okay, and now I'm just now realizing that on my record I still had that over medicated tag. Yeah. So
evil.
Yeah, that was fun. In the end, he gave me some
hydroxyzine.
The first time I tried prednisone.
Oh no!
And then I had a horrible reaction to the prednisone. Yeah,
you and Bug are really sensitive to meds. Like, I'm less sensitive.
Yeah,
my sensitivity is I take it and it just doesn't.
Right.
Like, you guys react horribly, and I don't react.
Well, think of it this way. We have the same thing you do. It doesn't work the way it's supposed to.
Yeah.
But we're also dying, so we don't notice that the other thing's not working. You know? It's like, I'm just not doing good, guys.
Yeah.
It was horrible.
Ugh.
But that, like, all those interactions, it'd be so much simpler if you could just be like, look, I'm not here for pain medications unless there's a problem and you deem fit, but I don't think I need them.
Like, I watched the woman who brought me the ibuprofen, and it wasn't the same person that I had talked to before.
Oh, they were waiting for you to freak out.
And I think they were. They were waiting for me to be like, oh God, it hurts so bad, and I'm out of pain meds. But, like, I didn't mention the pain meds at all until she brought me, like, here's some ibuprofen. And I was like, no. And she was like, what do you mean no? I was like,
she was probably waiting for you to be like, no,
that.
I need something harder.
I was like, I'm not going to take that. Like, it messes up my stomach. I'm on 3,600 milligrams of Tylenol every day. And I have better drugs at my house.
Prescribed.
So if nothing is wrong structurally,
Mhm.
I will just go home and take a muscle relaxer and a painkiller and go to bed.
Right.
And she just kind of was
Weather
like,
the storm.
okay.
I had that same reaction on the last thing I went in for. Do you remember what it was? Did I go in for some emergency? It wasn't a big deal, but I went in for something recently-ish.
Yeah.
And they did the same thing where they brought me the meds and they were like,
And then they wait and they're like, okay, how's he going to react?
and I was like, oh, cool, thank you.
Right.
I was like, what else are you going to say? Thank you for letting me have something.
Right.
I
Like, don't
appreciate
know.
it.
Mm-mm. If they could just ask,
Right.
what do you need or what do you want or whatever. And usually, like, if the doctor does ask, and I haven't always had bad experiences
No.
in the urgent care. Usually I have pretty good experiences. And usually it's because they do ask. They're
Mhm.
like, so what can I do for you?
Right.
And you're like, I just want to make sure that nothing's screwed up structurally.
Right.
That's all I need to know.
Mhm.
Literally. So, but also female doctor. Again. And we just don't click with the flippancy. Like, it doesn't.
Which is weird because I always get the
work.
like sarcastic, flippant nurses that are girls.
The nurses are fine for the most part.
Yeah, the doctors.
The-
Yeah, no.
Depends.
Female doctors.
Female doctors are really difficult for me
Yeah.
to work with because
Yeah.
they won't just trust that I know what I need.
Right.
And that is the part that's annoying. Because,
Mhm.
like, if I can just lay it out for a doctor and be like, look, here's this really easy course of action. And they're like, cool, I can do that. That's it.
Yeah.
But when they're like, I got to tell myself a whole story about why you're here and what you need and what you think you need and what you think you want and what you're going to, like, try to trick us out of. Like, stop it.
It's not a fucking
You
game.
made it up. Stop.
Well, and those people enjoy it.
Mhm.
These nurses like
Well,
their
'cause
jobs.
it's like policing. Yeah.
Right.
It's the same thing as, like,
I just
when mall cops
Yeah.
are having a wonderful time.
yeah.
Because they're like,
Exactly.
oh, look at all this power that I'm wielding. And you're like, dude,
Stick
nobody cares.
and I'm confused with the power that I found.
Yes.
Yeah.
God, it's just the most frustrating thing.
Wouldn't it be nice if, like, during the triage step,
Mhm.
they just ask you straight up, like,
Yeah.
do you or have you ever taken pain medications?
Right.
Would you be adverse? Like, they can ask you if, like,
Right.
where you stand
Ask
on it.
questions. Oh my gosh.
Then you can
Ask
make
questions.
the assumption.
There's actually there's a new CDC. Yeah, CDC recommendation about pain medication that
Oh,
just
yeah.
came out.
We can think.
Yeah, it's
Changing
gonna
the
s-
doses, right? Like,
well, it's about, like, not being so strict about setting targets for
Mhm.
people, like target dosages and target, like,
yeah.
trying to constantly titrate people down
Mhm.
because the target is 0, the target is 0, the target is 0. It's like, why are we doing that to people? What is the goal? What are you trying to accomplish in that?
Actually, okay, so this conversation kind of fits anyways. It's
Mhm.
part of what we're talking about. But I don't know if this is universal or if it's just me. When I first started taking pain meds,
Yeah.
like regularly, and I was already freaking out about it, because the stigma that comes with it. Like, you come into this, like, there's a drug problem. Oh my God, I'm
Yeah.
part of the drug problem now.
Oh God.
Oh my God, I need these every day. And they're like, their goal is none.
Yeah.
Right.
The goal is none.
But you're like, I'm getting worse by the day.
Right.
And so I was intimidated and scared because in my head, what I understood was the only thing that's going to happen is I get this month,
Mhm.
and then next month we're titrate down, and then nothing.
Yeah. Yeah.
Like, that was, I thought,
Well, that's
that was
why,
my
like-
my overreaching pain management.
Right. Well, and this is exactly why, like, my husband calls me the heroin dragon.
Yeah,
Because I'm like, hoard it all because you don't know when they're going to cut you off.
yeah,
And you're going to have nothing. And you're going to need something someday when you've got nothing left and nobody's going
Right,
to help you.
but it's like you're planning for this
Mm-hmm.
because it's, I mean,
Yeah.
you can't feel secure in it. First off, you feel like a bad person for taking them. Second off,
Yeah.
could you imagine being like, I'm content with this?
Right.
You just, it seems like you're a douchebag all of a sudden. Like,
Right.
Like, I
Right.
feel like a drug addict just thinking that I'm okay with where I'm at.
Yeah.
Like, I function through the day.
This works fine for me.
I've been
Yeah.
doing it for almost 10 years now.
Yeah.
I'm not abusing my meds.
Yeah.
But I mean, still in my head, I'm like, you're horrible. You're a monster. You know what I mean?
Well, and you don't crave them, and you don't like.
No.
There's no. It's not addiction. It's
No,
not.
it's
But
dependence, if anything.
Yeah.
But we
But it's
titrate
like
down so
a
quick.
physical dependence, right?
yeah,
like
yeah.
your body has gotten used to this substance.
Well, there's
And
also
without
like,
it, it's going to have to purge that substance.
we get the physical,
Yeah.
but there's also an emotional dependence to it because people will take pain meds to treat their emotions. Like things are overwhelming, so now I'm going to take
But
my
I
pain
don't
meds.
know why. Like
I don't either.
what
I don't get
happy
anything.
pleasure point. Yeah, okay. So we're on the same page.
Yeah,
here.
yeah.
What happy button does it push in people's brains? Because like when I take pain medication, I feel better. I don't feel awesome. I
No,
feel
but better. Yeah.
And that makes me feel productive because I'm not in horrible pain. But it's not like euphoria.
No.
Like it's not like I'm on cloud 9 all of a sudden and I'm like
No, and
elevated mood and
the worst-
whatever.
The worst thing for me is that like if I take like when I was on my higher dose,
Mhm.
it would make me sleepy.
Yes.
That was about it. That was all I would get out of it is that pain would go away, but then I can't be productive because
Yes.
I'm asleep.
So that was it was the origin of the Wombo combo, right?
Yeah, the Wombo
They
combo.
like, and we both did this because this is where we both started, I think.
Mhm.
Or I don't know if you started there, but you got there. In any case, so when I started pain medication in the very beginning,
Mhm.
it was, oh my gosh, it's like a low income clinic, and I was working with them.
Yeah,
And I had horrible sciatica, like
Mhm.
crying, couldn't move sciatica.
Yeah.
And so they gave me 30 pills and cyclobenzaprine.
Yeah.
And the combination was just, you can't be in pain if you're unconscious.
Right. But that's not what we were looking to
then-
get out of it.
Right. So it was great for like, I need to turn it off, but
Mhm.
it was like, that's the end of that day. That's it. So that was the bailout.
Mhm.
Right. So that's bailout strategy. And then now it's becoming more like I'm having trouble functioning because of the amount of pain I'm in.
Mhm.
We're going to improve functioning with a either lower dose or like better food. I want to say
Right.
hygiene, but you know what I mean.
No, yeah, you're balancing it out.
Yeah.
It's not because it's not what everyone assumes it is, or it's
Right.
just like here, take more meds.
Well, but we've had time to like tweak it and fine tune
Exactly.
it also. And that's the other part that I think a lot of doctors have a hard time with is that like we've been doing this for a long time.
Yeah.
We know what works for us.
Mhm.
We've been able to like fine tune things.
Yeah.
Please just believe us on what we need.
Yeah, no. Well, and see, that's a beautiful
And then
thing.
we can have conversations
My-
about it.
My constant care, like Anna and David, and
Mhm.
you know, they all trust me
Yeah.
to where they're like, is everything in balance? Like
Mhm.
that's the question I get is like, how do you feel? Do you feel like everything's balanced? And I
Right.
go, yeah,
See, that makes perfect sense.
right. I don't know.
See, and I get like, they want to move me to low dose naltrexone, and I know it works for some people, but like, things are getting so bad so fast,
Here's
and
the problem.
so
with
many
that.
things are going bad so fast that I don't want to completely cut off access to what works in the
I was
hope
gonna
that something might work.
draw you a visualization of how I see this because I thought
Okay.
about doing the naltrexone too, right?
Yeah.
So this is kind of like what Harper drew, like the pain line. Was it
Oh
Harper?
yeah, like the baseline versus whatever,
right.
whatever.
So like
Yeah.
you know, here's normal, blah blah. I'll catch it all. I'll show you at the end. And this is us on pain meds, right? But what we
Oh,
have
yeah.
to do for naltrexone is drop the pain meds.
Yes.
So nothing.
So we have to plummet to like rock
First,
bottom.
you have to get past the dependency and what your body's used to, right? Then you have to go with just pain every day. Naltrexone doesn't kick in until way down here.
Yeah.
So 6 weeks of nothing
No.
for a thing that might work.
Yeah. No.
And I'm not against
I'm not,
it, but
I'm not on board with that though.
you have a life.
Yeah.
You have a job you have to do. You have
A house I have
changing,
to
ever changing
maintain.
body issues.
Uh-huh.
So like
Ugh.
a 6 week commitment, I could do it. It would suck, but like
Oh,
I don't
God.
have the same
It'd be
commitments
awful,
as you do,
though.
though, right?
Yeah.
Like so, like it's ridiculous.
It's just so like I don't know. The whole idea that the goal is 0 is so hard for me because here's the thing. We're not acknowledging as a country the number of people who are on pain medications who are not addicts.
No, we get discounted.
Right. And they're like, everything is risk of addiction. But also, what are you doing to help addicts? Nothing. You're trying to prevent addicts and prevent addiction.
Well, yeah, see,
but that's not how it works.
That was the nice thing about New Health was
Jeez.
the way they paired it with all the other things, right?
Mm-hmm.
So there was like education on your meds, which was part of the doctor visit.
Yeah.
Then there was the therapy, so that you weren't
Right.
emotionally dependent on it, and that you could talk to them and be open about everything.
Yeah.
Work on your PTSD or whatever. And then they did the physical to rebuild everything because, PT does have a function.
Yeah.
We get thrown into PT for weird things so that, they're like, well, we don't want to do surgery right away. Let's try PT. And then when that doesn't work, we get the, okay, surgery.
Yeah.
And we wish they would just go to surgery. But
Right.
whatever.
Exactly. And it's just so frustrating because, like, they changing the guidelines could be helpful, right? But it could also just not. Because how many people are actually like going through and paying attention to those guidelines in the first place? Until their like head brings it to everybody and says, this is what we're doing. Everybody's policies are different.
Yeah.
Right?
Yeah. I would really appreciate it if they just redid like kind of what they're saying in there where it's not I guess like a
I
paradigm
feel like
shift, but I can't articulate.
if they were going to do a paradigm shift, this is how I would do it. And it would be essentially the New Health model, right? Yeah. It would be, you need pain medication. Oh, okay, so wait. We got to back up a little bit because we got to touch on chronic versus acute.
Oh, yeah.
Right?
Before we hit
because
break.
This is going to explain some of that. So chronic versus acute pain. And this is where we with Ehlers-Danlos syndrome get so stuck and frustrated and annoyed. And
all the invisible illnesses have the same problem where any chronic illness will have this problem. Anyone suffering with a chronic illness where they want to treat the pain. If it's acute pain, then opiates are a go because you can titrate after the acute pain's gone. But if you have chronic pain, you take Tylenol.
Yeah.
I mean, that's the thinking, right?
Uh-huh.
Because it's long term.
Yeah. But
what if your acute pain is your chronic pain?
Right.
Like say you have a tumor in your spine and your entire left side is on fire and you can't walk.
Right. Or you've dislocated your hip.
Right.
Because that's pretty acute, friend. That's pretty acute.
And it happens all the time.
Really
so
painful.
Chronic.
And chronic because it happens again and again and again.
Yeah.
Like everything we go through is both chronic and acute.
Mm-hmm.
Why? Like jaw pain, acute.
Right.
Did that does it happen a lot that it like will dislocate sometimes? Yes.
So
chronic.
The way to visualize it or to contextualize it, in their heads, acute pain, injury, something that just happened, a dislocation even on someone who doesn't have chronic dislocations,
right?
Something immediate. And then in their heads, you have the chronic pain, which is someone has a sore back,
right?
Like,
right.
Oh no,
you have an
old man
injury that
Jenkins
causes you pain to this day. Yeah,
it has a sore back,
never healed.
But for us, it's like, I'm a fucking trash fire, guys. You want to talk about my knees while my arm's falling off? Cool.
Right.
Like,
okay, wait. Status report right now.
Like where I am?
Yeah. What's happening in the body?
Both my knees are shot. But if I straighten them, which I did earlier, they're on fire more. Mm-hmm. So Bent is happy. My left hip is out a little bit and it's sitting on a nerve. And my shoulders are throbbing.
Yep, there you go. So for me, my ankles are on fire and I can feel the left one sliding out of place and getting ready to spasm in the foot. My left hip is a little messed up right now, but I think it's probably from the way I'm sitting. But I'm sitting this way because my tailbone is stabbing me.
Yeah.
And also my hand hurts.
And then tomorrow,
like morning hand.
Wipe the slate clean.
Right.
And then
a whole new selection.
Right.
Unless you really screwed something up. And then that one stays on the docket for like a week or two.
What if this is some gamer ass logic right here. So in games, you have cooldowns, right?
Okay.
You have things that are like a constant passive ability that are always on,
Mhm.
and then you have skills, right? What if we just look at acute as a chronic acute?
Oh.
We put it together, and it's like for the day you hit knee pain, hip pain, legs, and then it cools down. Like at the end of the day, reset. Can we think of it that way? Can we put it in gamer terms so that we know what debuffs I have? And that they're random? Spin the wheel for your random
It's
debuff.
fantastic. Yes.
I'm just saying.
What we should do is create like a survey that we take every day.
Like a pain journal, but one that's like,
Google
something we
form.
could.
Yeah. Like a Google form. If we could just do a Google form.
If we made
and then
a
we
form,
could see like I don't know, maybe we could.
I think we could.
And then you could see like a graph of what's going on
Yeah.
over time. Because it's just so frustrating. It's just so frustrating when they're just like, well, and my meltdown earlier this week was like, I had a moment where I was like, I wish I wasn't in so much pain. And then I was like, no, that's wrong. I wish I wasn't in so much pain for so long.
Yes. The cooldown.
Yeah.
You need your cooldown.
I was like, nothing is changing, and that's frustrating. Usually there's a reset at the end of the day. Like you go to sleep and you wake up with new things.
yeah. I think we should make like a sheet.
I think that would be cool.
And
like a Google form.
would people, like if we put it on the Discord server or we shared it on Google or something, would people fill it out like for a
That would be
week and
cool.
we could kind of note the body changes and see if there are any trends and like,
right.
You know what
And
I mean?
if there's like any correlations
Yeah.
across.
Or you can see it move.
Yeah.
You know what I mean? Like if your shoulder pain made you use your shoulder different that day, so then your chest hurts. You know what I mean? Like follow it.
Like what hurts today.
Yeah.
That'd be so interesting.
I would do that. I would fill out. We'd
I'd
have
be
to design
game.
it, but
yeah. So it'd be like a survey, basically.
yeah. But like set it up where like you can
Daily pain lineup.
daily pain lineup. Yeah. A way that we could like number it too.
Yeah.
So that
And
we could be
y'all
like,
will have to help us to like keep this updated on like what is the focus.
yeah, I think if we do this, I would do like a daily check-in, like a chat in the Discord.
Yeah.
And be like, did everyone do their survey
Or
today?
could we design it to like send it out to everybody like once a day?
I bet you Randy could do that.
I bet we could.
Especially with an RSS.
That would be so interesting. I'm so game for this idea. Sorry, we've gone on all kinds of different tracks. But
we went where the heart went.
yeah.
The passion.
The passion, it's coming. But yeah, it's a mess.
It is.
It's a mess. And I wish we could just show people why this whole like chronic versus acute planning thing doesn't work, where they're like, oh, it's acute pain because you just had your teeth out, therefore it's Tylenol. Like,
right.
What is this?
Mm-hmm.
Why can't we be like, all right, what do you usually do for pain?
Yeah, no. I had a realization there. Just not like a breakthrough. It was just realizing that like people like nurses and stuff have their like go-to biases.
Yeah.
But like they also for their their pain treatment.
Yeah.
They have like a script.
Yeah, yeah.
They go through in their heads that they've developed from just dealing with
where
people.
They're like, well, studies have actually shown that.
Well, it's so personal too. Like some of them are like, oh, you're legitly in pain. I can tell. Let's treat it. Others are like, you shouldn't. God's watching. Shouldn't do it.
I've also had people be like, well, the more you like worry about it, the like worse it'll be. You're like, my knee is dislocating. What are you talking about? Well, they're like, well, you keep trying to pop it back in.
Well, yeah,
that's
I gotta
a problem.
Set it back. Sorry for setting myself.
Right.
We should go on break.
I agree.
And then when we come back, we're gonna do some TikTok reviews.
Yes.
With our favorite nurse Naya.
Yep.
And we'll do some reactions.
Calling
on
out
that.
some nasty nurses.
Yeah, and it'll help us focus our first half.
Rage,
because like there's just so much.
Oh my god, it's everywhere. Well, and hopefully I can kind of design my ideal protocol or setup. So, all right, friends. Hopefully by now you know what to do. If you are new here, you need to get some water. You need it. Hydrate.
Mm-hmm. Hydrate or dihydrate.
Exactly. Have a snack because you are a snack.
Fact.
There you go. Do something nice for yourself.
Mm-hmm. Ooh,
Yeah.
here's one. If you have access to a friend or an even better best friend, hug them.
Yes.
It'll surprise them
Or
and they'll like it,
virtually.
and you'll also enjoy it.
Yes. You can send them virtual hugs.
I
Yeah.
prefer the live ones, but
Well,
that's fine.
yeah, but if they're not like near
No, I
right
understand.
now,
Call them over.
be like,
Hey,
get over here now.
I have something urgent that we need to talk about. And then you just hug them for 10
it's
minutes.
my
and then kick them
love.
out. I love you. Goodbye.
Goodbye.
Out of my space now.
That's enough. Bye,
Also,
bye.
take a break if you need to.
Yes.
Don't push yourself too hard.
Yeah. And you know what? If it's a like in bed kind of day, don't beat yourself up. Your worth is not in your productivity.
Yep, I was about to say that. You are not what you produce.
Yes.
You are worth way more.
You are worth all of the things,
Mm-hmm.
no matter what you can do for others or for yourself even.
Yep.
So be kind to you.
Do it.
We're watching.
All right. Everyone, ready? 3, 2, 1, break.
Bye-bye. Hey guys, did you know that Fantastic Pains now has a website? On our website, you can find our shop where we will be opening up for custom t-shirts and orders there. You can also find access to our PayPal, Winky Wink. You can buy us a coffee anytime. We would love that. You can also see some of our blog articles, access to recent episodes and our TikTok, and get in contact with us.
You can also find a link to our Discord, which is getting updated pretty soon to include new channels and some games. We would also like to thank our producer for setting up the website. Thank you for supporting us and enjoy the rest of the show.
Indeed. Thank you.
Welcome back. How was your break?
Did you do the things?
Did you? Did you at least one?
We hope
The
so.
water one's easy. Come on.
You need water.
It's really good for you. Yes, I know there are better things like coffee and soda. Water. Just
Water.
a little.
Shh.
Yeah. Don't do as we do.
Do as we say.
Do as we, and we're telling you we're not morticians right now. So don't die by dehydration. Full circle. All right.
God.
So for the second half of our
Mhm.
conversation, to kind of help us
Hit the
dial in.
point.
Yeah.
Yeah.
We're going to be going through some TikToks
Mhm.
by one of our favorite TikTokers.
Yes, Nurse Naya on TikTok, who calls out unprofessional medical professionals.
And unprofessional patients.
Yes,
Ones that treat medical professionals like shit.
Yeah.
So this will be fun.
true.
This will be good.
But first, TikToks.
TikToks, yeah.
TikToks. All right. So here we go. So this is one of the top ones that I found. And just judging by this TikToker's caption down here, we know it's going to be a good reprimand here. So let's get
I
started.
would like to speak with the other woman that I was just speaking with. Stephanie.
You don't get to speak with her again.
Why not?
No, you lost that privilege when you started berating her over the phone and being extremely rude to someone that was just trying to help you. So
You're a doctor. Put your phone down. It always baffles me when I see doctors do this. You went through 4 years to get your bachelor's, 4 years of medical school, and then 3 to 7 years of residency, and you're doing this bullshit on social media? This should honestly be beneath you. POV, people get rude with my nurses, so I take over. Don't mess with those who control pain meds, needle length, and catheter size.
That's just a straight up threat.
So gross.
The implication there being that they'll just do whatever they want.
Right.
Which is what we
well,
were talking about.
and it could have been a like Karen situation if she had not captioned. Sorry. I bumped it
There
and
you
then
go.
bad things happened. If she had not captioned this, like, cool, people got rude with your nurses, so you took over and told them that, like, they can't speak to your nurse that way. Awesome.
Right.
But what is the caption down here? What
I
are
love
you
that.
doing?
don't mess with me or I'll hurt you.
Yeah.
And then not help you. Because I'm a nurse and I'm not here to help people.
I'll make it painful to
This isn't high
help
school,
you.
guys. This is your job. Hippocratic oath. Let's treat people
right.
like people.
Right. Let's see. What does she have to say for the
Oh,
rest of
in
this?
case you thought she was not really being serious, she added, remember that for emphasis. Good job, Dr. Becky. So, Dr. Becky, you're going to deny a patient pain meds because they're being rude to you, knowing as a doctor that pain goes through the body, goes through the limbic system in the brain, and that directly affects someone's emotions and how they express those emotions. So you're going to not treat the pain because the patient's being rude because the patient's in pain. And you can end all that by giving them pain medication, but you're not because they're being rude. You sound like a moron. Where did you go to medical school? Fisher-Price University? Was Doc McStuffins one of your professors?
I would like
Put it
to.
pause it. So, like,
Wonderful.
the other side of that is if you act too normal,
Yeah.
then you're faking it.
Yeah.
Like, so if you're perfectly polite and you can keep it together and you're like,
Yeah.
you know,
I
the
just
best
need
patient,
pain meds.
they're gonna be like, you're fine.
You're fine. Yeah.
What? You're not throwing a hissy fit, so I can't deny meds to you. So I'm gonna deny meds to you.
Oh God, it's just ridiculous. Yeah. Then, going to punish them with more pain by using big needles and catheters.
Mm-hmm.
Ridiculous. Absolutely unacceptable behavior. It's just so strange to me because, like, I don't understand. Like, obviously, don't be rude. 'Cause
Right.
You don't need to be. But at the same time, like, this caption, unacceptable.
Well, you're not gonna make a positive out of two negative reactions.
No.
It's not. You're not fixing the
No.
problem. You're helping anybody.
No. Well, and there are ways to deal with this. There's, like, trauma-informed care
Mm-hmm.
that deals with people who are a little irate,
Right.
right? Like, that's... Urgh. So this is one of Nurse Naya's calling out. There's a second one down here. It's...
When a patient
Let's see.
asks for pain.
So, what is this? So this is making fun of people in pain, apparently, which is great. Let's have a
medication.
look.
If I had to sit through this, so do you.
Aw,
They're
nice.
not healthcare workers. And this is long as hell, too. Long and bad.
Can I get some pain medication, please?
Yes, sir. What do you need?
Dog in the shot.
I have a terrible headache now. I need something for my headache, please. Save me.
What's your pain from 1 to 10? What's your...
You know what's scary is that she sounds like so many nurses that I know. She just sounds like I don't even...
Okay. So I'll bring you some Tylenol.
Okay.
Oh, God. This is so awful.
Tylenol? Oh,
And they were serious.
from all the medications, all you have is Tylenol? Come on, dude. What type of hospital is this?
This video should have been over already.
I am
Oh, no.
paying
Okay.
top money, okay? My Medicaid,
Wow.
Medicare,
no.
I got everything. And all
The Medicaid and Medicare. Oh, the mention. Gross. Oh.
you got is Tylenol? I want morphine, please. Morphine. Okay?
Okay, sir, but morphine will give you more headache.
Who told
Excuse
you
me,
that?
what?
No.
Where,
Who told you that?
where did you get your
Where did you
nursing
get this
degree?
information?
You get it from-
I've actually heard that
buy
before.
license? Like, are
Really?
you kidding
Yeah.
me?
Oh, they'll just tell you if
Morphine
it makes
does
it
not
worse.
give me
Mhm.
headache. Like, wait,
So they said
damn.
it's Jen.
This is bad. We're at
Morphine
1
takes
minute
care of your
38.
headache, man. Okay? I want my morphine. Can you please call somebody else? Come on. I don't got time for this. Come on, dude. Come on.
Okay, sir, relax. Would you like me to put the lights down? Some meditation, do some meditation.
Are you embarrassed for them?
Yes.
Yes.
I can't even be mad. I'm embarrassed for them.
Right.
Mm.
Huh? What do you want from me?
Oh my God.
What do you want from me, man?
What do you want?
It's already terrible enough that I have a headache.
Okay, sir, I got your morphine right here for your headache.
When do we do that? This is so bad.
Oh,
This is
no.
horrible.
Sir.
Horrible
Sir.
and ableist.
Sir, what are you doing?
Gosh, this video was so long and bad.
Dancing,
Yeah.
man. Look at that. I'm dancing.
What?
They were dead ass.
When a patient
Okay. That was just terrible.
Yeah.
That was non-medical professionals making fun of pain patients
And medical professionals.
and medical professionals.
The whole situation is just a joke to them.
Because everyone's an addict, and that's what we've taught everyone.
Yeah.
That's what we've taught people, is everyone's an addict. So it's totally okay to make
Mhm.
fun of them because if they're addicted, they're criminals
Yeah.
and don't deserve any kind of care.
For context, we forgot to mention Nurse Naya is a nurse, but she's also a chronic pain sufferer.
Yes.
She has seen everything.
Yes.
From all angles.
Yeah.
So
which is just such a unique angle to like actually share.
exactly.
Which is just so nice.
Which is why we defer to her. She knows what it's like, and she's real
on
about
both
it.
ends. Yeah. It's ridiculous. I don't understand why they would do that. This person as a chronic pain sufferer, I want to see them for the way they portray us. Oh no, it's terrible. I just don't understand. Like, go ahead.
It just dawned on me that there are people that go, ha ha ha, yeah, funny to this shit. You know what I mean? Like, ha ha, I get it. They're like those people in the hospital.
Oh my god, that's an icky thought.
It is.
That's hard too. Like,
that's some ableist bullshit.
how do we change the stigma when people who share their stories wind up in the Spoonie article
exactly
as examples of pain sufferers,
right,
in quotation marks, even though these people are crying in their hospital beds, begging for people to help them.
Yes.
And people take that and make fun of them. And then we have situations like this where it's like, oh, everyone's an addict and they're only there for whatever. Like, I just don't understand why.
You know what's really triggering to me is the way he acted at when he got like the morphine. The way he's like,
the like out. Yeah. The like, oh, it's clearly heroin.
Yeah, no. You know what happens to me when I get morphine?
Nothing.
No, it hurts. That's the stuff
really?
that burns. It hurts when they inject it into me.
Oh, weird.
My body goes tense and everything hurts, like really
yucky.
sharp pain.
I don't get that, but I get like it. Morphine's like Tylenol if Tylenol worked.
Right.
No,
I get pains.
That's how that feels.
I get morphine
that's
pains.
Terrible. Ugh. No good. I don't understand like meditation for a migraine headache. But that's like,
dude, if I would have said that to Jen last week, she would have murdered me. And I would have let her.
Right?
I would have been like, you know what? Good call. I shouldn't have said that.
You know why you're in pain? Because you're not being mindful.
Yeah, please.
You need to be more present in your headache. Please. Just more present.
I like that you're talking over me too. Like,
yeah,
no.
No.
Meditate.
Shh.
I'm allergic to meditation.
I'm allergic to meditation.
Meditation killed my father and robbed my mother.
I hope they're embarrassed. Like, I'm embarrassed for them.
No, they're not. They're clearly not.
It's just gross. Withdrawal, accident, or intense internal issue. What? I'm confused.
Is the staff obligated to treat pain, withdrawal, accident, or internal trauma?
Yes. That's medicine.
Ask for pain.
Well, and medically, someone who's in pain is going to be a lot harder to treat.
Yeah.
Like, you're not going to get clear answers. You're not
No.
going to get them to sit still.
Mm-mm.
Like, there's a reason for it.
Yeah, that was painful. Yes, it was.
I wish I had some of that morphine.
Oh, God. Ugh. I can't feel past my cringing. Yes.
I've forgotten how to
cringe.
feel.
It's
All I
cured
feel
my
is cringe.
pain.
Like a train.
Oh my god.
A cringe train.
A cringe train. Like a freight train made of cringe. A cringe train.
Oh no.
All right, let's see. We might have to cut here because depending on what we find. But we're gonna go scrolling. And see
We're
what
gonna
happens.
adventure.
All in one. How can I hear all this pain when
Okay, wait. We want to start this one over.
all in one?
Let's talk about pain.
I can pause it. Pain itself will not kill you, and achieving zero pain isn't unrealistic. We've said that.
We know this.
We talk about it all the time. We're
Yeah.
looking for an improvement of functionality.
Improvement, not perfection.
Right. We didn't have any of our surgeries to make ourselves perfect.
What you don't do is guess. Okay, yeah. So this is Naya over them.
Yeah.
Let's see what they say.
I'm constantly hurt. That's why I hope for the best, but I prepare for the worst.
Sometimes the only way to get to zero pain is to give a patient so many drugs. What? We'll have to use ventilators to keep them breathing.
Okay, I'm
and alive.
confused.
What
doctor is aiming for zero
Who
pain?
are you? Where do you work, sir?
That's ridiculous.
I'm confused
It
about
sounds
your
awfully
methods.
murdery.
I know. I was thinking. I'm like, you just tranquilize them to death.
Oh, this patient won't
what?
stop crying. Let's over medicate them until they're unconscious and on a ventilator.
Sometimes it says sometimes. So you're shooting for zero pain? Like what? What?
What you want to do is
My whole life is
What you won't do is gaslight. We just want to be able to function. If we want to be alive, we wouldn't need you. Literally what we said.
Yes.
Thank you, Nurse Naya. Thank you. Holy shit.
These people, my God. They're like, zero pain is unachievable, so we're going to just leave you in horrible
No
pain.
treatment, exactly.
Yeah.
Since zero's unattainable.
Zero's not an option, so, like, we're not going to treat it at all.
Right.
What?
Excuse me?
What? So we aim to make the pain bearable so a patient can function to a certain degree. Sure. This applies for patients we send home from the emergency department. The pain will eventually get better as the body heals over time.
Everything but that last sentence is true of us because we fall apart.
Yeah. Sure. This is what's frustrating for me is that they say things like this applies for patients that we send home.
Mm-hmm.
So what they do is they medicate them highly, go, oh, your pain is down, out.
Right.
And that's it. That's all they do. They're just like, bye. It'll get better eventually.
The first time I've ever prescribed pain medication was for my broken hand when that dog incident happened.
Oh, yeah.
And they put me on like 10 or 7.5 milligrams of Percocet, which is a lot to start.
Yeah.
To start
Yeah,
at Percocet.
What the heck?
Right. And so I had that for 2 weeks. And then I did a checkup and they were like, oh, it's still not set right, blah, blah, blah.
Yeah.
And I had to fight them to get something else because like I knew going to zero was going to be horrible.
Right.
So I was able to get them to put me on Tramadol, which I didn't know at the time was bad. Like that my body would react like it was nothing. But I think it was better than having nothing. You know what I mean?
Yeah.
But
that's what they do. And that's like,
I had to
we want them to function to a certain degree. So you make it bearable.
Mm-hmm.
And then you kick them out the door. And then you wonder why they're frequent flyers.
Right. Why they come back.
Because you've not treated the problem.
Yeah.
And you've not communicated with them about the problem either. That's the other big one is they're like, we did some x-rays. Nothing's broken. Bye now.
Right.
And you're like, okay, but what's wrong with me? Why do I feel like this? Why am I in pain? You're going to kick me out the door and I'm going to be in pain in 4 hours.
Mm-hmm.
Like, why do you think this cycle perpetuates itself?
Right.
It's just stupid. It's stupid.
Yeah.
Pain is not going to kill you. No. But it can cause a series of events in your body that could not be sustainable with life. It can do that. Yeah, there are people who are in so much pain that they want to unalive themselves.
Mm-hmm.
But I guess that doesn't count for you because you consider that a personal failure.
Yep.
Mm-hmm.
There are people in this world who are in pain and it will never be alleviated. It's not going to go away. Neuropathic pain, yeah, that's a bitch.
Mm-hmm.
Yeah.
But you know that, you're a doctor. A lot of people who are in pain just want the pain control to the point where they can be a functioning member of society.
Yes.
I don't know a lot of people
pause
who
it here real
enjoy
quick.
sitting at home.
So, functional member of society, we have to be because the world is not forgiving. Society is not forgiving of being in pain. Like,
well, it's like a race. You fall behind and you can't catch up.
right.
Like,
And then, like, how are you going to make money?
mm-hmm.
How are you going to, like, contribute? How are you going to, because it's all measured with that productivity, right?
Right. And your self-worth is all tied up into it too.
Yeah.
So you're
And we have no
spiraling.
choice
Yeah.
but to reach for that.
Yep. I love what she's about to say because this is something I've said a lot
Yeah.
about how it's not fun to sit at home in pain.
Right.
It's not
enjoyable.
It's not, aha, you got a break. No. It's I went to work today and it sucked because I couldn't get away from it.
Yeah.
It's
or for me, it's like I went to work. I had a point where I couldn't bear it
right.
and I needed to bail out
Mm-hmm.
and I can't do that at work. So I had to go home.
Right.
I had to go home and take pain medication and not be at my job and not be able to do anything until that thing kicked in so that I could make dinner for my household.
Right. Yeah, no, exactly.
It's not like you're like, kick back on the couch and
It's
like,
not fun.
yeah, this is so enjoyable.
No, days that I can't get out of bed aren't comfy.
No.
Like I had a cold. It's like
Ha.
I'm in so much pain that moving hurts.
Yeah.
And laying down hurts. And I can't, you're trapped. You can't get away from it.
Mhm.
There's no escape.
Yeah. Or you like sit in the bathtub and rewarm it over and
Oh
over
my
again.
God,
over again.
dude.
Those days.
No, what you do is you start it off hot, and then you just only add hot water until you're in nothing but the hot tub, basically.
Yes.
You know, like you're melting yourself.
You're like, I can't feel anything now. I've
There.
burned all of my nerves.
yeah, exactly. I've done that. That was my go-to move.
I did it earlier this week.
Mhm.
So it's not fun. It's not fun.
No.
God.
And
But-
it's not like an oh poor me type mentality either. We're not bemoaning it. We're just
No,
in
it's
it.
just not. It's not like a vacation.
Right.
That's really what it is. Is like, it's not fun.
No.
Nobody enjoys sitting at home in pain.
And doing nothing, and then having people judge them for doing nothing.
Exactly, and then feeling lazy.
right,
the
feeling
whole
like
time.
they're in the wrong
Mhm.
for doing something that is good for them.
Right, and being in pain, and then feeling like you're wrong for being in pain.
Oh, yeah.
And maybe it's just you, and maybe other people deal with this all the time.
Yep.
And are functioning.
Yeah.
Like,
That was my favorite thought for the longest time was how does everybody else do it?
Yeah.
How? Because I can't. I'm like a failure at life because I
Yeah.
can't function the way they do.
Because God help us, like so many people with Ehlers-Danlos syndrome specifically don't find a diagnosis for years.
Right.
And years and years and years. And people tell them over and over again that they are fine and there's nothing wrong
Yeah, I
with
was gonna
them.
say like it's not just not finding it.
No,
It's being told that
being
you're.
told that you're fine
Yeah.
over and over again.
And
And
then
you know
you ha-
you're not.
You have to become that person that everyone makes fun of, the
Mhm.
chronic pain patient who hunted down their diagnosis.
Yeah.
There's no winning. There's literally no winning.
Right. No, because you're not you're not in the normal.
Right.
So therefore, you suck.
Yeah, you're not fitting the mold. Please fit in the mold.
Right.
Just shut up about pain and do your job.
Get back to the factory.
The bunny factory.
No, no. Not the
I
bunny
was
factory.
built on
No,
the
stop
factory.
the trauma.
We start
Play the
at
video.
8 and we don't get break
Let's
till
let's continue.
When I was a travel nurse and I was dealing with unmanaged, unbearable pain, all I wanted was just enough pain medication to keep me from having to leave work early
Yeah.
until I could figure out what was wrong with me.
Yeah.
I didn't want to be, sedated into a comatose state.
Thank you. Yeah.
Nurse Naya, I love you.
Oh,
I hope you watch this
I
video.
love that she
because-
said exactly what we were
Yeah.
just saying.
No, for real. Like,
Because that's exactly it. Like I want to be able to function well enough so that I don't have to hit the bailout point.
exactly.
I want to be able to catch it early, be functional, and not have to bail out. And I'm sorry, and this is where I'm going to be in trouble asking or talking to my
your team.
my pain team, yeah, because I'm going to have to talk to them about like I can't sleep unless I take a pain medication
Yeah.
because like gravity hurts so bad and the muscle spasms hurt so bad
Well, and that's
all the time.
and you're ignoring just laying in bed can be painful.
Right.
You're just
Yeah.
you dislocate from laying in bed.
Laying down hurts.
Yeah.
It hurts. Like profoundly it hurts. And so what are you supposed to do? I'm like, I'm going to have to talk to my team, be like, I need just enough.
And it's going to be
to
such an awkward
function.
conversation.
Yeah.
And it shouldn't be.
Right.
It really shouldn't be. It should be,
Is
here's
it gonna
what's
be
going
like
on.
I knew we were going this way.
Well, see, yeah.
What about that low dose naltrexone? No, I'm not doing that. I'm sorry. Like I thought I was going to be in a better place to be able to like give it a try at some point.
Right.
But not now. My life is like a steady downhill currently.
Mhm.
I can't. God, so awful, so
Mhm.
irritating.
Yeah.
Other people's kids, damn it.
On the side note, though, the stuff that she's doing, Nurse Naya,
Huge.
the amount of validation I just got from watching
Right.
3 videos, like,
Right. Like we're like, oh God, we're seen and we're valid and we're humans.
yeah,
Because they dehumanize us and they turn us into this like, you know how vets talk about dogs where they're like, well, you could just do like olive oil and some like fish oil. He's only got like 2 years left, so we're not gonna really like want to medicate a whole lot.
yeah, we're not going to operate and prolong his life.
right. Okay.
I do. I
Okay.
hate that.
Yeah.
Because we get it on the opposite end, or at least we used to. I'm less
Oh, you're
out of
too young.
too young
to,
for surgery.
yeah. Too young to have your stuff repaired.
Which
You're
is messed
too
up because it goes with the acknowledgement. Oh, we saw the damage in there. We're just
But
hoping that
that's too
PT
bad.
will fix it. because you're too young for surgery.
We just need you to stall for a little bit. A few years, really.
Yeah.
Yeah. No, it's awful. It's just not okay. Wait. Go back. What was that?
Oh, I'm already
Hold
triggered.
on. Reasons for not coming into the emergency department. Okay.
The first thing I saw was chipped tooth, and I'm like, fuck you. Just straight up. Sorry.
Have you ever chipped your tooth? Toothaches, especially at night. What? We do not have dentists in the emergency department. Sunburn. Actually, liar. Fucking go. If you have a serious sunburn,
I took my
go
friend Nick in.
to the emergency room because that can lead to all kinds of things. That can be
Infection.
delayed heat stroke.
Oh yeah.
first of all,
Oh yeah.
because of the inflammation.
Mm-hmm.
That's huge.
Yeah, I took my friend Nick in, and they treated us like assholes. But he had a sunburn from one day of work.
Yeah,
it was his whole arm
blistering. Right,
it was a giant blister.
Yeah,
and it was purple.
Yeah,
and I was like, you need to have that looked at the very least,
and
then
treated.
They treated him like he was.
Treat it.
He was there for meds, but he clearly wasn't. He was like.
It takes you 7 minutes to be a decent human being, and treat these people. Why?
Yep.
God.
Yeah, no. Back pain that's been there for 18 months. I had that one for the longest time because of shoulder pain. I'd go in. Is this
start
new?
Telling them it's new.
I did.
You're like, oh my God, I don't know what happened.
Yeah. I'd be like, oh, I reached over and something happened. Yeah. Because if I told them it was chronic, they'd be like, oh, we can't help you. Go away.
Yeah. Go away. Bye-bye.
A rash on your private parts. Trust me, unless it's falling off, we're not interested.
Go to the sexual health clinic. Anything fungal on the skin. But how do you know it's fungal and not a flesh-eating disease?
Exactly.
People don't always know it's fungal, buddy. Children who swallow sand on the beach. Oh, okay, fine. I thought it said bleach, and I was like, what?
Did you get the likes, views, and attention that you were looking for?
Get them.
Well, I'm glad that you feel better about this idiotic post. Toothaches, chipped teeth. Now, Doc, chipped teeth and toothaches aren't always chipped teeth and toothaches. A chipped tooth can be the sign of someone was assaulted physically. A toothache isn't always a toothache. It could be a massive infection. That could be a tumor pushing up against their spine. It could.
That! You nailed it!
Naya! We love you.
Literally.
Please come be on our podcast.
Suffered for years,
oh
4
my
years,
God.
with back pain and side pain from a tumor that was pressing on my spine.
And this woman just nailed it out of the blue. Look at that.
I love you.
Been validated so hard today.
It's my day. I'm having a good day.
Could be. I mean, if back pain that's been there for 18 months, that could very well be a tumor that you don't feel like you should have to deal with. Oh, and this is the best one, being sarcastic. A rash on your private parts. So every person that is a victim of SA and sex trafficking shouldn't come to the ED to potentially get help because
you don't feel like
that.
Yeah.
We're not interested.
They're not interested.
That is what you should be seeing in the ED. We're not interested. Go to the sexual health clinic. Wow. You're an awful provider. You're awful. You have some of the worst judgment I have ever seen. This is a very, very unsafe, stupid post.
Yeah. Yes.
I do. If you're interested, Nurse Naya, we're kind of flippant and maybe a bit rude, but we can tone it down if you want to do an over the internet view.
She seems really prim and proper.
No, I know, but I just don't want to assume people are okay with the way we do things. So, but if you're interested, we would love to pick your brain.
Right? That's incredible. Yeah. Wow. Ugh. And so many people are just oh my gosh, here's one. My mother had a sunburn so bad it was actually sun poisoning. Glad the ER took us seriously back then.
Mm-hmm.
Oh my God. For a toothache, turns out it was a septic abscess.
Oh yeah, no.
But don't go in for a toothache.
Going septic is fine. Dentists can fix that with Botox.
Whatever.
They'll just Botox your
Good Lord. Bro, I can't eat. Yeah. Oh my God. An ER nurse was mad at them for coming in with oh my God. What'd you say?
Oh no. With a clogged feeding. Bro, I can't eat. I can't take meds. I can't hydrate.
Idiots.
Why are you in the ER? because I have a problem. And
Medical
you're
gaslighting is real. Yes, it is.
absolutely.
Yes, it is.
Check out our episode on medical gaslighting, season 3.
Yeah. Holy cow. This is, yeah. Could be a toothache. Could be a heart attack. True. Most people can't, like, oh, God. Yeah, sunburns can get really bad. Dude, stop practicing medicine right now. It's time to retire. Go home. Go home. You can work at the library. That's it. We don't want to hear you.
Think about it. Like, this person or doctor, let's say, has had so many experiences with people that he's deemed unworthy of his attention.
Yep.
But these people came in because they were scared. No one goes to the ER and goes, I feel fine.
Right.
You know what I mean? Like,
well, and I'm sorry, but like your shift is your shift no matter what you're doing. So why are you like deeming things like worthy of your attention and unworthy of your attention? Just do your job.
Help the
and
people.
then go home. Like
Nick was terrified with his sunburn. It was so bad. He was freaked out. He didn't want to go in.
Just awful.
But we did, and I'm glad we did because they wrapped it up and he gave him an ointment.
Yeah. Yeah. He also says go to the chiropractor. What?
Hey, no. Don't shit on the chiropractor. But don't do
I'm
chiropractor before
what?
ER.
For what?
Yeah.
Is what I'm wondering. I'm like, wait. Why is he? Okay. God.
Oh my God, dude. Okay.
Jesus.
Yeah.
All right, moving on because that one made me angry.
Oh, yeah.
Here we go. Ready?
You're
Let's see.
experiencing
Severe endometriosis flare up. Okay.
In a room.
Oh,
Up in a
no.
room. At Twitter.
What? Going to the ER as a woman and being treated like a drug seeker, part 2.
All right, let's
All right, let's see. Actually, is there a part 1? No.
No,
Okay.
it's okay.
you're experiencing severe endometriosis flare up and a rheumatoid.
The purpose of the emergency room is not to treat your chronic pain. It is there for emergencies. Your chronic pain conditions are not an emergency. These are things that should be discussed with your primary care physician, and you should have a plan for your pain flare-ups. Again, not.
Okay, but when your primary care doctor has been told not to prescribe pain medication at all costs,
Yeah. Ours is.
and you are in horrible pain right then,
Mhm.
your primary care doctor is not a phone call away. They're not.
Also.
They're like 3 days contact
Oh,
away.
totally. But you don't go to the ER with chronic pain. With chronic pain, this has been my experience. I can't say.
Mhm.
I don't go in for chronic pain because I noticed it.
Right.
It suddenly changed and is more
Uh-huh.
severe. And I'm worried there's a problem.
Yep. Or it's absolutely unbearable and like your next move is
Well, it
jumping off a
changed.
bridge.
Like yeah, exactly.
Yeah.
Like it's not like you go, oh, you know what? I want to go to the ER today
I've
because I
had
have
it.
chronic pain.
Yeah. Oh my God. Like, and I'm sorry, endometriosis is extremely painful.
Mm-hmm.
Extremely
It's no
painful.
joke.
You literally have uterus bits growing all over your body.
Mhm.
They found them in your lungs, like in people's lungs before.
Yeah.
That's insane.
No, don't go to the ER though. Don't waste their time.
All right.
Schedule an appointment with your primary care, and
then
in 2
wait
weeks,
3 weeks, and then talk about the pain you were in 3 weeks ago.
Dude,
and now you don't want to do that again.
Okay.
Wow.
I got it.
Okay, here we go.
Not an emergency. This is why we get pissed off in the ER.
Oh, you poor baby.
You blocked me. I wanted to see this video originally, but it said video not available. And I don't remember us having any run-ins. So that leads me to believe that you know that you're saying some
Mhm.
shit. You didn't want me to see it. So now I'm extra motivated to respond. And someone has chronic, unbearable pain 24/7, and then they have a bout of excruciating pain that they've never felt before, that's an emergency. That's usually a sign that something is horribly wrong. And if it isn't, you should say, thank God it wasn't something that went horribly wrong. That's what you should be saying as a nurse. Not,
Yep.
This is something you should be dealing with your pain management doctor for. Well, if they don't have one, then they have to go to the ER. Get over it. Do your job. And if you don't want to be a nurse because you don't want extra work to do, just say that. Don't blame it on the patient because you're lazy. Because that's all that you're saying here. I'm a bitter, lazy nurse who should retire.
Yep.
the school nurse that everyone hates. The nurse that tells a kid who busted their head open, "Oh, just put some ice on it and go back to class." That's you. That's you. And nobody likes you. What kills me is that you have a little over 1,000 followers and you have a backup. Why do you have a backup account? You want another place where you can be, hateful and ableist? No, we're good. Honestly, you shouldn't be caring for patients anymore. If patients presenting to you in pain anger you this much, you don't need to be a nurse. I take my patients, as they come. I don't want to determine, well, you don't need my type of care.
You're not worth
Then,
my care.
if you want to determine that, then why don't you become a provider and you can determine what kind of patients you take. Until then, shut the fuck up and do some vital signs.
Hey!
And remember, pain is the fifth one. Don't minimize that.
Get it. Get it.
She's the best.
I love her. Oh my God. Everything.
This has been one of my favorite episodes. I'm not gonna lie.
That makes me happy. Like, that's exactly it. Like, there's nothing else to say after that.
No, nailed it.
You nailed it. But it's just, why? Why do you feel like, do you want there to be no patients in the emergency room?
Right?
And you want to sit on your ass for the entire shift?
They interrupted Angry Birds, let's be honest. She was going to get really far in Angry Birds, and then somebody came in with chronic pain.
Right. Well, then I'm sorry. The other part of it is great, you have tons of paperwork and stuff to do. Don't be mad at patients. Be mad at the people who are handing that stuff down to you. Be mad at the people who need you to document everything that you eat, sleep, breathe. I don't know what the heck you have to do that you are so upset about, but Jesus.
Yeah, helping people doesn't seem to be on that list.
Oh, God. Do your job. Do your job. You are not the keeper of medicine.
That's the biggest thing. Do your job that you spent all that time on.
Yeah.
At any point, you could have realized you hated your job and switched.
Right.
You got this
I'm
far.
sorry, you're in the ER. Go do something else.
Right. Yeah. There are
you
other
don't
positions.
have to be in the ER. Want to talk about who doesn't belong in the ER?
My God,
Angry nurses. My God, it's ridiculous. Yeah. Endometriosis in the top 20 pain conditions. Severe acute pain flare-ups can happen.
Mm-hmm.
Yeah. Things like endometriosis can burst. And then you can hemorrhage.
Oh, yeah. Oh, you're not supposed to do that?
It's only a cup
Chris,
of blood. It's
no,
fine.
Chris, no.
Oh, geez. Oh, no.
Is it bad?
Oh.
I'll tell you later.
Oh, okay.
Horrible, inappropriate joke. Just imagine the worst thing you can, and I thought it. And now I'm mad at myself.
Oh, God. Let's see. Yeah, even having access to all of my records, I still have nurses like her. Jeez.
Yeah.
Yep. Mm-hmm.
Well, and again, your record might have big notes in it that say, hey, this person's a problem.
Yeah. Yep. Chronic pain can be fatal. Yeah, let's talk about the unaliving rate.
Raise your hand if you've been on the unaliving rate list as a static or a statistic.
Right?
I have.
Mm-hmm. we were yeah. But
I just shake you out of the
poor
closet.
woman.
You're like PTSD. I'm like, hey, come here. This one. Everybody look. Sorry.
But do you remember the poor woman with the cluster headaches?
Yes.
Suicide headaches is what they nickname them
Mm-hmm.
because it's unbearable. It's absolutely crazy. It can be fatal in that sense. Yeah.
Mm-hmm.
Thank you. This has been my TED Talk. Next TikTok.
Sorry.
Another one.
Not another one.
Steroids, antidepressants. Those are two medications that aren't controlled substances that can cause a person to go through withdrawals if they abruptly stop taking them.
Wow.
That doesn't mean that they have an addiction. Addiction is not drug dependency. Addiction is judged on the behaviors that the person displays that are dangerous.
Mm-hmm.
That they will take the drug even if it hurts them. That's an addiction.
Mm-hmm.
So I ask you kindly to go back to the kids' tale where you belong and leave the conversation of addiction and drug dependency to people who actually want to take the time to research it. Because all you're doing is stigmatizing people who are in pain.
Yes. Absolutely.
She's kind of the best.
It's so irritating. Like why are we conflating one for the other? And it just is rampant, and nobody is correcting that.
Yeah. Well,
like you don't see medical professionals outside of Nurse Naya almost at all correcting that.
Mm-hmm. Yeah. On my records, we talked about this before when I got to go through it. I had dependency on there.
Mm-hmm.
But this is the interesting thing is that when the nurse at the ER saw that I had that, she assumed it was an addiction. So I think it was one of the times I had to be wheeled in, like on a like I had to sit down and have like Jen push me in. Oh, it was post back surgery. That's what it was.
Oh God!
I went in because it was my hand when my hand was all jacked up and cut.
Yeah.
They saw that and she started treating me like I was a drug addict.
Yep.
Like, no, that's not. Do you know the difference? There's dependency, which is pretty straightforward. Your body is dependent on this thing, a chemical that it doesn't make anymore because you're giving it to it.
Yep.
And then there's addiction, which means you can't function without it. You need it. Everything is this.
Yeah. Like you stole from your mother to go get more.
Right.
You've been to 7 ERs in 24 hours. Like, that would be amazing timing, but you know what I mean.
Right. Like
that is addiction. It is the
it's shit like that makes like doctor shopping hard.
Yeah.
Because they look at that as a negative behavior instead of trying to find someone who's compatible with you.
Right. Right. Which is silly because they're like, oh, if your therapist doesn't work, get a new therapist. Why is that not the case for every doctor you see? Because they're supposed to be like infallible.
Right.
Believe your doctor at all costs. Meh. Stupid. Yeah, there's a big difference. Let's see what's next.
I'm crying.
What is this?
Typical Westar Medical Center customer service. Then these nurses should be termed.
How do I settle down when I'm hurting?
You lay down.
These are the type of nurses that we trust with our health. Emergency room nurses who are telling a woman who is crying, screaming in agony that she needs to keep it down because, she's disturbing, the ED. I'm sorry, are we keeping you from sipping on your Starbucks and scrolling through TikTok?
Trying to dissociate at work?
Because I know for a fact a lot of y'all do that.
Mm-hmm.
I work in an ED. I know that. And I know that you get annoyed when there's any sort of inconvenience, anything. Yep. You will try to shut it down because y'all don't know how to deal with situations like that. It's either chemical restraint, mechanical restraints, or security. That's it. The amount of times that I've been called as part of the behavioral...
Yes. Okay. So their solution is not to treat the pain. Their solution is to knock you out so that you are not bothering them.
Mm-hmm.
But you'll give them sedatives, like free of
well,
not
think
free
about
of charge,
it. Think
but
about
you know
it.
what I mean.
Like it's just it feeds the circle because this person is now knows they have learned that if they throw a fit, that's the way to get what they need.
Right. Like,
so it's not going to change the behavior.
It's fine.
Right. And then you come in the next visit and you're having an issue and the only way to get their attention is to throw a fit. Oh, now you're a drug seeker.
Yeah.
Like you're faking it.
Yeah.
You can't teach them to behave that
I'm
way.
gonna
and
go
punish
in
them for
and be
behaving
like,
that way.
I'm addicted to sedatives.
Please sedate me.
You better give me pain meds. Oh,
take my
terrible.
Bones.
Take my bones.
Your response team simply because a patient is crying is ridiculous.
Okay, so what she was just saying was the behavioral response team.
Mm-hmm.
It's like high school never ends.
Right.
That's how this feels. It is like the same weird prison type structure of compliance and shut up.
Mm-hmm.
Comply and shut up. So you can't comply and be noisy.
Right.
And you can't comply and cry because God forbid you're in pain and crying.
Or scared even. You know what I mean?
Too.
Like,
yeah. God.
No one's having a good time in the ER.
No, comply and shut up. Oh, you have like a stick that's gone through your torso.
Leave it.
You better shut up. Just shut up. Shut up.
We get it. You got a cool new hip stick. Who cares? Zip it so I can go back to my phone. Zip it.
Shut up.
That's not what I'm fucking here for. They have no empathy. They don't. They only care about themselves.
I think that's good. for
Yeah.
now. That was
a really good, like, I'm glad we found them. Because I was like, oh, we're going to scroll.
oh no.
No, they were there. They were ready. And they were right on it with what we were talking about.
Yeah.
And it's, can we go back to that one that was like, we don't have to go back to it, but
Yeah,
back
it
in
talks
terms of
back.
like talking about the one where they talk about like, we don't want to talk about. Did I fix it? No, just broke it some more.
There you go.
There. Okay. Sorry. I need to stop messing with it so much. My bad. Where they talk about like, we don't want to talk to you about your chronic pain.
Right.
You have chronic pain, don't even bother. You have acute pain, on the other hand. That might mean something's wrong. But your chronic pain,
Did turn
clearly
acute.
you haven't died yet. So
Right. That's
it's fine.
that's a weird correlation, but that is how they reason it out, it seems.
Yeah, they're like, oh, it's been there for that long. Oh,
You've had this for
Yeah.
like what was it, 18 months?
18 months.
18 months and it got really bad all of a sudden. You're going to be fine. There are 18 months of you not dying.
Right.
You're 36. You made it to 36 and you're not dead.
So clearly you're fine. It's
Let's
fine.
make some correlations here. I'm a doctor. I know math. The math is there. You're not going to die. You've been alive. You're in pain, but you're not going to die.
Right.
And they fall down dead.
Uh-oh.
That was an
We never checked them in. They didn't make it through
It's
the
not
door.
official. They never did triage. It's not real. It didn't happen. Wasn't me.
They were never checked in.
Oh my God, dude.
God.
We're in a
It's
mood.
the worst. But it's validating
Mhm.
to be able to like,
Well, and to have
hear it.
someone who knows both sides,
yeah.
to know that we're not like spewing crap.
Mhm.
Because I'm always worried that we're saying stuff that could be harmful to people.
But it's not though.
I
Because
know. It's a worry.
you're
I
a
have.
human being who deserves care. You are a human being who does not deserve to be left in pain just for the sake of being left in pain
Mhm.
and for the sake of the like drug epidemics that have ba 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 ba.
Yeah.
Good God, why? Just stop it. Get some help.
TLDR, Nurse Naya, you're awesome.
Yes,
Thank you
Yes,
for making
indeed.
TikToks and talking things out.
it was good stuff.
We love you.
And for seeing both sides of the
Yeah,
coin there, because
absolutely.
I get it. It's important to understand like nurses are overworked in general.
Yeah.
But the patients didn't do that to you.
Right.
Don't be angry with them. Like stuff goes wrong at work. The kids didn't do it to me. I don't go after the kids. I don't make fun of the kids.
Right.
I don't say nasty things about the kids. I don't like,
There are teachers that do though.
but exactly.
Fuck, man.
And they need to retire.
I'm working on it, okay? I have 1 week left until retiring. Then,
I have to beat a few more children before I can go.
I mean, I have kids. I could do that. I'm going to go beat my kids up with love. I'm going to hug the crap out of them. Be like, thank you for being awesome humans.
They're gonna be like, "What's wrong with you,
Dad, why are you weird?
Gross.
I hate you, Dad.
Ew."
No, you don't. You love me.
Yeah, they do.
No, don't. Sophie makes that face. She goes, no.
Yes. Max on Resident Alien reminds me so much of Rory.
Oh, yeah.
It's
Oh, yeah.
not even funny. Oh my God. So much. And Randy too. He was saying it last night. He was like, he reminds me of Rory. I was like, yep, exactly. Yes.
All right.
Time to call it, friends.
We still have more work to do after this, though.
Yeah.
We got a secret surprise.
Yeah.
Secret surprise in the works.
Wahaha.
So look forward to that. Wednesday video, maybe next Wednesday, not this Wednesday, next Wednesday. Maybe this Wednesday. I don't know.
Maybe
We'll
the
see.
Wednesday before this video. Not the Wednesday before this video. Maybe after this video. But maybe the week after. I don't know.
Yeah.
We'll see. It'll be there eventually.
Mhm.
Meh. Yeah. All right, my friends. Thank you so much for coming along. I hope you enjoyed our dive into reprimanding bad medical professionals.
It just seemed right. Like after your experience yesterday where they
Yeah.
treated you like a crazy person, I was like,
Yeah.
yeah.
And then you instantly regret going. And then that in and of itself
So
is so
dangerous.
dangerous.
Yeah.
So dangerous.
Let's
We
teach
can't
them
do
not to
that.
come in because there's
Ever.
problems.
Right. Don't ever come in ever. Nope.
But yeah.
Yeah. So if you enjoyed it, give it a like, share it,
Subscribe if you haven't.
And yeah, check out the website.
We have goodies coming.
Yep.
We have merch that's
Mm-hmm.
new merch that's less expensive
Yes.
and more fun.
Custom
And we're going to
designs.
have our Fantastic Pains logo finally on the
Yep.
shirt or something.
Yeah.
Whatever.
I just need the digital copy, and then we're good to go.
Yep.
It'll be good.
Sweet.
Whoop whoop. All right, friends. Thank you so much for coming along. We really appreciate you. I hope you have a wonderful day. Make sure you take care of you. Look out. Look out. Just look out in general.
Ah, got him.
Look after yourself. Be kind to others, and have a great one. Bye-bye.
Bye.